welcome to all of you, which is now on. I'm very glad that we could do this webinar with GOED. And you know, GOED is just a global organization on EPA and DHA. And today's topic is educating consumers and healthcare professionals on benefits of omega-3s. So thanks to Alan Schott and Alana Natker for being on board today. Alana will share some of her valuable insights about communication of omega-3s, and I will come back to you too. There are several reasons why Blue Legasea organizes this webinar. First and foremost, we share GOED's objectives to communicate scientific-based knowledge on omega-3s. There is simply a need for this to be done to increase the intake of omega-3s. Secondly, not all of you know this maybe, but Blue Legasea was founded by a group of omega-3 producers in our region, Møre og Romsdal here in Norway. And this part of the marine ingredient industry has been fundamental for the development of a cluster and our ambition to increase the value of marine products. We are now 50 partners representing the whole value chain from catching of fish to finished product. So of course, supporting the omega-3 part of our cluster by bringing updated knowledge to both professionals and consumers is important to us. We will get started, but first some practical information. We will be recording this webinar so that it also can be available on our website later on, together with Alana's presentation. For questions during the webinar, please use the Q&A symbol and write down your questions, and it will be addressed to our speaker and Ellen eventually. As attendees, your microphones are muted, so please write if anything. So we are glad to have Alan Schott here, Executive Director of GOED, and I know that a lot of you registered here today already know her and her expertise. I don't know, Alan, is there anything you would like to add or about yourself or GOED?
Well, good morning, everyone. I'm very happy to be here on behalf of GOED. And as Amthinka said, you know, Legasea has been a really good partner to us, and we do share common goals. So we're excited to just participate today. I do know that a lot of you know GOED, and Alana is really the one who's going to give a little bit of background on our organization. So I won't take up any more of your time.
Yeah. And as you said, thank you. And as you said, Alana Natker is the main speaker today, and she holds the position as Director of Consumer and Health Practitioner Communications for GOED.
My background is in both communications and in nutrition, as I started my career in public relations and then went back to school 10 years later to become a registered dietitian. In my job now, I take those two skills and combine them together using effective communications to reach both consumers and the healthcare practitioners who influence them. So I realize many of you work as suppliers to finished product companies and may wonder, why do I need to know how to reach the consumer since they aren't my customer? The answer is that consumers are always the end customer, no matter what part of the supply chain that you're on. And they're the reason why you're doing what you do. We all are doing what we do. Suppliers and finished product companies who work together and together understand consumers and what their needs are and what their interests are, they tend to have more effective partnerships and outcomes. So that's why I'm glad that you're here today, and hopefully this will be good information for everybody. If you want to click to the next slide. So again, I'm going to just give a little bit of background on GOED if you're not if you're unfamiliar with GOED. We are the global organization for EPA and DHA omega-3s. We're a trade organization, a trade association that is global in reach. We have about 170 members all across the globe. And our goal is to increase awareness of the science-backed benefits of EPA and DHA omega-3s to ensure that the products out there in the marketplace are of high quality and items that consumers can trust and will opt to incorporate into their diets. There are 3 ways that you can find us online. There's our GOED Omega-3 website, goedomega3.com, and that is for our members. And that has all the information about GOED membership and the benefits in the voluntary monograph that all of our members adhere to as a condition of membership. There is the alwaysomega3s.com website, which is our consumer website. So that has all of the health benefits and the science behind omega-3s in a very consumer-friendly way. And then there's fatsoflife.com, which is the website that's geared toward health practitioners themselves, healthcare professionals, that has a lot more of the science behind EPA and DHA omega-3s, where they can find that information. And we'll explain in a little bit later why there are those two websites that essentially have the same basic information, but take it in two different ways, because it's important to be able to reach those audiences in a way that they will find trustworthy and easy to understand. Can you go to the next slide? So before we dive too much into this, I just want to, as my dietitian in me, I want to give you all a review on fats. And if you just want to click 4 times for the pictures that come up. So there are 2 major kinds of fats in the diet. There are saturated fats, such as butter and things that are hard at room temperature. And then there are unsaturated fats, which tend to be liquid at room temperature. Of those unsaturated fats, we can break that down even further into 2 major types of monounsaturated fats. So they are unsaturated in just one place in their molecule chain. And then there are polyunsaturated fats that have more than 1 degrees of saturation. Digging even deeper there, we can talk about polyunsaturated fats as omega-6 fats and omega-3 fats. If you go to the next slide. Now let's talk about omega-3 fats. And you can click 2 more times. So there are 3 major types of omega-3 fatty acids in the diet. There is alpha-linolenic acid, ALA, which tend to come from plant sources such as flaxseed, which this picture is. And then there's EPA and DHA omega-3s, which tend to come from marine-based sources such as fish and fish oil type products. Next slide. Okay, now we get to our first polling question. I hope that you can all participate in this. The question that I wanted to ask you is, are omega-3 fats essential? Are we able to do this poll?
I will just a second. Yeah, I think we are. Just a second. Now, so you will get all some time to answer this. Not long, because I think you should know this. So we'll end the polling like in 5 seconds. So I hope you can all answer and see that. Okay, we are 60% voted. Can we get anybody more? Okay, I'll stop it now. So let's see. I will share the results with you. Hope you all can see that.
There we go. 94% say that they are essential, and then 6% say sometimes.
Yeah.
Well, I will be able to tell you that the answer really is depends. It kind of depends, especially here in the United States anyway, we have a definition of what essential means. You can go to the next slide. So in terms of, our natural inclination is to talk about omega-3s as essential fats because consumers need omega-3s. That's something that we all know, but necessary and essential are actually 2 different things. Mm-hmm. When we talk about essential, what that really means, what the definition is that the body must get it from the diet, that there is no way that your body will be able to get this nutrient unless you eat it or somehow bring it into the body. I can just continue to explain. So as we talked about, there's 3 major types of omega-3s. There's alpha-linolenic acid, ALA, EPA, and DHA. Of those omega-3s, ALA is considered essential. It is the one that your body you cannot make it on its own. It must be eaten in foods or taken as a supplement. And that's because, and you'll see, and there's a diagram here that shows there are different steps that the body can do to convert ALA down to EPA and DHA. There we go. So you see it on the right side of your screen here. There's different, the middle words in black, desaturase and elongase, those are all different kinds of enzymes in the body. The thing is that the omega-3s and the omega-6s compete for the same enzymes. And there's a preference for the omega-6s. So as your body takes in those 2 essential fatty acids, whether it's linolenic acid, an omega-6, or alpha-linolenic acid, the omega-3, that enzyme that's going to break them down into more unsaturated fatty acids is something that competes. So click one more time and you'll see that first thing that's desaturates, that's circled, because that is the rate limiting step. So while alpha-linolenic acid can go through all of those steps to make EPA and DHA, the steps is actually very slow and very ineffective. It only happens about 5%, maybe 20% of the time. It depends on the body, it depends on a whole host of things. So in that case, that's just my very long explanation to say, it's best to get your EPA and DHA directly from your diet, just like you would ALA, because you cannot depend on ALA to get your body's EPA and DHA. Okay, next slide. So we've talked about what omega-3s are. Now let's talk about why you need them. As with any unsaturated fat, omega-3s are associated with various health benefits, namely prenatal health, brain health, eye health, and heart health. Heart health in particular, we have a lot of research on. Next slide, we'll talk about these different various health benefits. So first is omega-3 and prenatal health. And there's a lot of research in this area. That's why many pregnant women are told to take their omega-3s during pregnancy, because it helps with the baby's growing brain. It helps with their the development of their eyes, retinal development and visual development. And for pregnancy itself, for a healthy pregnancy, it helps mom bring that baby closer to term. So there's some research that shows that taking omega-3s helps prevent early preterm birth, which is birth before 34 weeks, and also low birth weight. So having babies that are just so small, and both of those, usually with early preterm birth, that is a low birth weight baby. And those babies spend a lot of time in the NICU, and it's just a very dangerous time. So taking those omega-3s are a great way for mom to have a healthy pregnancy and for babies to have proper brain development and eye development. Moving on, next slide. Related to that in some ways is the issue of omega-3s and brain health. So we've already talked about how it helps with baby's brain and growing brain. We know that DHA is concentrated in the brain, and that is one of the places in which DHA is concentrated in the body. It's also concentrated in the retina of the eye. And we have seen studies that show that it helps with improvements in cognition and working memory, and may help prevent age-related cognitive decline. So what happens as your cognition faculties as you age, and they tend to decrease over time. There's even some emerging areas of research that's really exciting and worth watching on EPA and DHA and areas of mental health, such as attention deficit hyperactivity disorder, ADHD, major depressive disorder, and other mood disorders, such as bipolar and schizophrenia. So those are some early areas of research, but really hot right now and definitely worth watching. And also showing some research in the areas of omega-3s and a potential as a treatment for traumatic brain injury or concussion. Next slide. We talked a little bit about retinal development for babies, omega-3s, and eye health. And we have also seen that there is some benefits of omega-3s as you age in terms of well, dry eye, which can happen at any age, and also age-related macular degeneration. So just like your brain tends to decline in cognitive faculties as you age, same goes with the eyes. This shows how omega-3s are beneficial all throughout life, from early infancy all the way through to older age, and there's benefits throughout. And we'll even get to that in terms of heart health, which is the next slide. And that's an area that we have quite a bit of research. So omega-3s and heart health, I think it is well understood that omega-3s are among the most studied nutrients in the world, with more than 40,000 published papers on the topic, 4,000 of those papers on clinical trials. And heart health and omega-3s take up a lot of those studies. The benefits of omega-3s and heart health are particularly strong. There are many ways to talk about heart health outcomes. You can put them in terms of risk for coronary heart disease, which is specific to the heart. You could talk about it as cardiovascular disease, so all the heart and the arteries throughout the body, heart attack and cardiovascular events, and so on. Generally speaking, though, we can attest omega-3s with these cardiovascular benefits. Here we go. Mortality, lowering your triglycerides, improving your blood vessel function. Well, I'll continue. So there's three major studies on heart health were just reported on back in 2018, which sounds like forever ago, but it was really just a year and a half ago, that we saw these 3 major studies on omega-3s and heart health. And so the first one, and you may have heard about them already, but I'll just briefly go through them. The first one was ASCEND, which was a study on cardiovascular events in diabetes. This was published in August 2018 in the New England Journal of Medicine. And this followed over 15,000 subjects with diabetes who hadn't shown any sign of cardiovascular disease. Perfect. The treatment group was given 1 gram per day of omega-3s. So 1 gram, which provided from that 840 milligrams of EPA and DHA. The other group got a placebo, and the study did not find any evidence of a benefit of EPA and DHA for serious vascular events or death from any cause, which was the primary outcome of the study. However, they did see an 18% statistically significant reduction in vascular death for those with the EPA and DHA treatment group. In the Reduce-It study, this was a study, oh no, back to the other side, thanks. The Reduce-It study showed that this was one done by Amarin, which is a pharmaceutical company, on their Vascepa drug, in which participants were given 4 grams of EPA and saw a significant reduction in major cardiac events. So this was very positive in showing how a certain omega-3, EPA in particular, can help reduce major cardiovascular events. Vital is the third trial that we have heard quite a bit about and that we're continuing to hear more about. And this was a trial that was funded by the National Institutes of Health, the NIH, here in the US. And the investigators looked at whether taking a daily vitamin D and or EPA and DHA, again, a 1 gram dosage, which gave 840 milligrams of EPA and DHA, reduced the risk of major cardiovascular disease events, same type of thing. In this trial, the omega-3s demonstrated no benefit for cancer outcomes, which we wouldn't have expected anyway, because there's really no solid research on omega-3s and benefiting cancer outcomes. But what we did see was significant effects on omega-3s for total heart attacks or myocardial infarctions, coronary heart disease, a 17% reduced risk. We even saw a reduced risk for fatal heart attacks, but the group in which this occurred was very low. So we take that one with a grain of salt. We definitely need more research to be done in this area. But again, we're seeing some solid benefits of these 3 studies and omega-3s on various outcomes for heart disease. We're even seeing some follow-on trials from the same researchers that did the Vital study, if you want to go to the next slide, that suggests that more omega-3s might even be better. So in this follow-up study, which was done in 2019, the authors here, same researchers that did the Vital study, did a further meta-analysis which found that marine omega-3 supplementation, so EPA and DHA, lowers the risk for heart attack, coronary heart disease, and cardiovascular disease. Even when you exclude the results from the Reduce-It trial. Remember, the Reduce-It trial had a very high dose, so even if you take that one away that might have skewed the results, we still saw these beneficial effects. They also wrote, and this is what I want to highlight, is that risk reductions appeared to be linearly related to marine omega-3 dose. In other words, the more omega-3s taken, the greater the risk reduction. We're going to probably see more of this as well, but this is very promising for the omega-3 industry. Next slide. So we've talked about omega-3s, what they are. We've talked about omega-3s and why they're beneficial. Now let's talk about omega-3s and the types that you need. So on the next slide, please. Oftentimes when we tell consumers, you need to get more omega-3s, and I hear this among my dietitian friends, I see this in news media when they say, you need more omega-3s, here's how you need to get it. And then if you just want to click through about 6 times, you can see you can get them from fish, you can get them from flax, you can get them from nuts and seeds, milk, eggs, maybe a supplement. These are all things that I see in the news media as ways to increase your omega-3s. And it's true, these are all omega-3s. But if you click one more time, only a couple of these are really going to increase the EPA and DHA, the specific omega-3s that demonstrate these health benefits. So on the next slide, we need to change our language. And that language shouldn't be just simply get more omega-3s. What it needs to be is get more EPA and DHA omega-3s. Well, I'll tell you GOED's recommendation. GOED recommends that for the average healthy adult, they should be getting 500 milligrams of combined EPA and DHA per day. If you are pregnant or lactating, that number should be 700 to 1,000 milligrams of EPA and DHA per day. Of that, actually 300 should be DHA. So minimum 300 milligrams of DHA per day, but combined you should be getting 700 to 1,000 if you're pregnant or lactating or nursing. If you have a specific health condition and you're using the omega-3s as a form of treatment, so if this is something like high blood pressure or high triglycerides, then your needs increase to about 1,000 milligrams or 1 gram per day or greater. That's GOED's recommendation. On the next slide. I should say that around the world, recommendations vary. Then they can vary based on omega-3s generally. They can vary based on amounts of EPA and or DHA. So for the sake of argument here, I'm going to stick to America since I know the recommendations pretty well. And let's talk about the dietary guidelines for Americans. So these are a policy document that comes out every 5 years. They get updated every 5 years. And it's to help guide Americans toward healthier eating habits. So this is really meant to be a food-related document. But there is a little bit of language in here on EPA and DHA omega-3s, and you'll find it in the section on protein, specifically on the subsection about seafood. So what you see here is that they recommend that people eat 8 ounces of seafood per week, and that's usually in 2 4-ounce portions. So you eat two seafood meals per week of various types of seafood. They don't even specifically say fatty fish, although it's going to give you your EPA and DHA. So 8 ounces of seafood, which provide an average daily consumption of 250 milligrams per day of EPA and DHA. And this is, as it's quoted, associated with reduced cardiac deaths among individuals with and without pre-existing cardiovascular disease. So eating an average of 250 milligrams per day of EPA and DHA helps reduce risk for cardiovascular disease, whether you have it or not. That's what our dietary guidelines recommends. Next slide. So that's EPA and DHA. ALA, on the other hand, is a little easier to talk about in terms of intake needs versus actual amounts. And that's because ALA is that true essential nutrient that we talked about in the beginning. That ALA has a dietary reference intake amount, so how much you need to be having per day. According to the Institute of Medicine, which is the one that comes out with these dietary reference intake amounts, most adults need between 1.1 and 1.6 grams of ALA per day. And this number increases for women during pregnancy and lactation. But we can see for, what the numbers are for ALA intake needs. Let's go to the next slide. This is why the next few slides are going to talk about why we truly need to change our language from getting more omega-3s generally to getting more EPA and DHA omega-3s. And this is going to be kind of hard to see on the slide, but I'll explain this to you. So this chart here is taken directly from data that we do in the U.S. called NHANES, which is a surveillance data of what people eat and the nutrients that they get. We see that the average intake of ALA omega-3s is just over 2 grams for men and just over 1.6 grams for women. So I pulled out the important stuff on the chart to the right, where we have the adequate intake based on the Institute of Medicine report, and then what people are actually eating. So people are getting enough ALA omega-3s in their diet, quite enough. On the next slide, please. Well, here's where we see intake for EPA and DHA omega-3s. If we look at the dietary guidelines, like I mentioned earlier, and we're talking about 250 average intake, 250 milligrams for men and women, but then we look at their actual intake and we're looking at adults, the actual intake for men is only 100 milligrams of EPA plus DHA, only 90 milligrams for females. And what we'll talk about, what we heard about with that other follow-on study after the VITAL study, is this 250 milligrams that's already being recommended might be too low, because we're seeing that more may be better. Okay, next slide. So how are we going to boost EPA and DHA omega-3 intake? Moving on, how we talk to consumers. So we know that people need to get their omega-3s. We know that people are not getting enough omega-3s. So the current dietary guidelines recommends that you should be getting 2 servings of fish per week, which is what these pictures recommend. And that'll give you about 250 milligrams daily. But if you click through 2 more times, you've got to get these fish servings each week, which most Americans anyway are not doing, not even close. And these fish servings can't be poor sources of omega-3s. So they can't be eating shrimp, which a lot of people here in the United States eat. They can't be eating tilapia. Fried fish negates any heart health benefits that you might have, because the act of frying just cuts out the fish, cuts out the health benefits. So 2 servings of fish per week, it's a good recommendation, but that's not going to quite get us to where we need. So on the next slide. What we could do is ask people to have 3 servings of fish per week. Maybe we ask them to also have foods that are fortified or have added EPA and DHA to them. There's a lot of milk products that have added DHA and things like that. That will give you more than 250 milligrams as a daily average. But since we can barely get people to eat 2 servings of fish per week, I think it's going to be impossible to ask for 3 servings of fish per week. So this is not quite the solution that I think is valuable. Although adding that fortified food is worthwhile. I should mention that any food that has added nutrients added to them, we're not adding them in huge amounts. They're supposed to just be a little bit more in the diet. So we're only talking about additional intake of maybe 30 to 100 milligrams per serving. Not going to get us to where we need to be. Next slide. Here's what I think is the best strategy for talking with consumers about increasing their omega-3 intake. The best strategy is to try to get those 2 servings of fish per week. Try to incorporate fortified foods as much as you can, and take a daily supplement. The daily supplement will give you at least, it gives you an exact amount of the EPA and DHA that you're getting. You have control over that amount. And if your diet isn't quite up to par, or if you're eating the wrong kinds of fish, or whatever it might be, that will help keep your intake at least at a baseline level. So that's what I recommend. Next slide. It's not just getting a supplement, but knowing how to read a supplement label. So this is actually really important because I've noticed that many consumers don't know how to do this, and even a lot of healthcare practitioners don't know how to do this. So I'm going to break it down for everybody right here. The first things that you need to look for on a supplement label, well, and this is actually out of order with the numbers that I have here, but I don't pay much attention to the front side of the label. It tells me what the product is, and that's great, and it gives me the amount of, let's say for this, fish oil. But as I mentioned, at least in those studies that I was talking about, you could be given 1,000 milligrams of an omega-3, but of that, only 840 milligrams are EPA and DHA. So the same idea is in place here on a supplement product. So in the front of the label will tell you your total omega-3s, or your total amount of fish oil, whatever that may be. So what you need to do is look at the supplement facts label. Then what I do is I look down at this number 2 that you see here on the screen, the EPA and the DHA amounts. And I look down there and I take those 2 numbers, I have to do a little bit of mathematics, and add those together. Those numbers I want to make sure get me to 500 milligrams or so if I'm aiming for the GOED's recommendation. I also need to look up top at that number 1 item to see, well, how many supplements, how many pills or soft gels am I talking about? So if the serving size here is 2, but I'm only taking 1, then I have to take those 2 EPA and DHA numbers and cut them in half, because I'm not getting enough. I'm not getting that serving. So all of that mathematics, all of that's really important. If you're vegetarian or vegan, or you want to make sure that your product doesn't have a specific type of fish, that's where you look at the number 4 here and your ingredients. information. So that's where you look to see what types of fish are in your product and if that's something that is important to you. So that's my little tutorial on how to read a supplement label. Okay, next slide. Okay, so we've talked a little bit about omega-3s, what they are, why you need them, why consumers, or the fact that consumers aren't getting them. So now we need to talk about how to talk to consumers in order to get more omega-3s. So next slide, please. This is where I want to bring to your attention some consumer research that GOED does. And we do this on a regular basis where we gauge consumers all around the world on their knowledge of omega-3s and how they like to get information about health, their health information, who they trust for information and things like that. So I pulled some data of countries that I thought would be of interest to this audience. And the good news is across the board, for the most part, consumers all around the world are very knowledgeable, or at least are aware of what omega-3s are, and that's good. So we can at least start from there that most people know what omega-3s are. Next slide. When it comes to health concerns, when we polled the different people throughout different countries of what are concerns that are most concerning to them, overall wellness is by and large what's their top concern. And then after that, it kind of depends upon the country. A lot of people we notice are concerned about sleep or maybe family health or things like that. But what we do notice, at least what's interesting to me, is I put together messaging communications for consumers on behalf of GOED, is we know that there's science on heart health and brain health and omega-3s, but getting that specific with certain consumers, they don't care. It's at least not in their consideration set when it comes to their major concerns. So when I talk to consumers, I want to keep it more broad, more general to overall wellness. I want to keep it to things like your family in some cases. Unfortunately, I can't tie omega-3s to better sleep. If I could, that would be fantastic, but we don't have the science behind that. But in any case, this helps me understand that while we have the science to support things like heart health and brain health with omega-3s, I have to couch it into something that talks about more general overall health and wellness. Okay, on the next slide. This slide I think is quite important as well. And this is, where do consumers trust, or by whom do consumers trust their health information? So it probably should come as no big surprise that for the most part, people trust their health practitioners for solid information on nutrition, on health. Friends and family and labels on products, even the internet falls to a distant second and third, except in China, in which the internet seems to be higher. And I think they're just a tech-forward culture, so maybe that's why. I don't really know. But in any case, this is some very interesting data that we have that shows that healthcare practitioners should be the conduits, the influencers to help us reach the consumers. So it's important to both reach consumers directly, but also reach the healthcare practitioners, because that's who the consumers trust. So we need to educate them and provide them with the information that they need to educate the consumer. Okay, next slide. So how do we reach the consumers? Well, as I just said, we use influencers. So if you click, I think one more. Yep, okay. So influencers. And as we've indicated, those influencers for consumers are healthcare practitioners. So with GOED, the ones that we've identified to help reach consumers are nurses, nurse practitioners, physician assistants. So especially in the US, nurse practitioners and physician assistants are the ones who have more time to interact with patients, to counsel more on lifestyle issues. We found that regular physicians are very quick to write a prescription or do something. You have a problem, here's a script for it. So it's a harder education for them to get them to even think about lifestyle changes or supplements for omega-3s. So talking with nurse practitioners and with physician assistants, and also with pharmacists, as you see in the bottom right side of your screen, because they're the ones at the point of sale for the most part with consumers when they talk about dietary supplements. I also know in France, pharmacists are highly regarded. So it's also country dependent. In the top left box, the top left picture, is dietitians. That's a dietitian website and an article that she wrote on her website that we've worked with. So dietitians that we've seen, especially in the US, are really good influencers because they're the ones with credentialed, the nutrition credentials, and which we'll get to in our next thing, they also are the ones that are typically quoted in news media on nutrition related information. So they have that double side where they're an influencer and they're also helpful in the media. So if you go to the next slide, when we talk about media, this goes back into, to some degree, internet as a source for information, because a lot of the news media now that people are consuming is news that is online. And just having ways to get our information out there that is credible, that is, because there's a lot of information, there's a lot of misinformation, especially about omega-3s that's out there. So if we can get ahead of that with sponsored posts with dietitians that we've done. So we work with dietitians on messaging on their blogs and on their social media space. But even working with those that write for major publications and making sure that they have the messaging and that they are educated so that when they do articles about omega-3s, that they have the right information, they have the right facts, or they have GOED as a resource to come back to interview. And then next slide, making sure that you have the right messaging. And this is key. And this is, I alluded to this in the beginning of the presentation. Talking to consumers and talking to health practitioners, even though the end result should be the same, trying to get them to increase omega-3 intake, the way you go about it needs to be different. With health practitioners, you do need to talk about cardiovascular disease, or you do need to talk about, they don't understand what heart health is. Heart health is a nebulous term that means kind of nothing to them. So you talk to them about the specific study and the specific outcomes, and that builds credibility. For a consumer, talk to them about disease, and unless they actually have that disease or it's something important to them, they don't care. They don't want to hear about it. But you talk about heart health or overall wellness, and they'll listen. Okay, same goes, I know we get a lot of questions about omega-3s and bleeding. Consumers don't want to hear about bleeding. What are you talking about bleeding? But physicians and healthcare practitioners, those are questions that are that are on top of their mind. So we talk to them about the studies done on perioperative bleeding and those outcomes. So you've got to make sure that you know the right topic and the right way to address that topic with those different audiences. Okay, next slide. And we also want to talk about just some common questions that we get from consumers, because I'm sure that these are questions that you all get in your interactions with your customers or even with consumers themselves. So we'll just quickly go through these. A lot of times people say, can I get my omega-3s from flax or chia? And we've already talked about this. The next slide. The answer to that is no, you really can't, because ALAs don't convert well to EPA and DHA. Most people are getting enough of their ALAs already. So if we could depend on that, then we would see that EPA and DHA levels would go up, but that's not happening. The other answer, as we said, the science is just so much stronger for EPA and DHA. Okay, next slide. Why do I need supplements? I eat fish. Well, we kind of talked about this as well, where even if you're eating the two types of fish, if you're eating fish twice a week and there's still like the salmon and the mackerel and the sardines, fantastic. Go to the next slide. It's a great way to get your omega-3s and other beneficial nutrients, but fact is most people aren't getting enough. And we're even showing in the research that more might be better. Okay, so next slide. I've heard omega-3s increase risk of bleeding. We just talked about this. Next slide. That's a myth. Okay, I get this question over and over and over again. And the truth is that research continues to debunk this myth about omega-3s and excessive bleeding. So let's just put this to bed right now for all of us. A 2017 meta-analysis showed that there was no increase in bleeding or blood transfusions during surgery. And another paper came out that showed higher omega-3 levels before surgery. And that's how you have to measure bleeding. I mean, that's where you do the most bleeding is during surgery. So higher omega-3 intakes before surgery is associated with a lower risk of bleeding or needing blood transfusion. So overall, especially for people that have been told by their doctors, don't take your omega-3s before a surgery, or if you're on blood thinners or something like that, there's no research that shows that there is a high risk of that. Moving on. I'm concerned about mercury and contaminants. That's another thing. Next slide. Well, this we can put to bed pretty quickly. We know that the refining process for omega-3s removes the contaminants and heavy metals, including mercury. So that should not be a concern when it comes to omega-3 supplementation. Next slide. This is still on the topic of mercury and contaminants, but there was a researcher at the National Institutes of Health, Dr. Hiblin, who did some research that found, this was on fish intake, because I know there's a lot of recommendations for pregnant women and their fish intake, and if they need to limit that because of the risk of mercury. And we can look at the slide as much as we want, but the basic thing is when you eat fish, it corresponds in IQ increases, IQ point increases, because as we said, the omega-3s contribute to better cognition and brain development. So the corresponding increase based on his research saw that eating up to 12 ounces of fish per week can increase IQ of up to 5.5 points in his research. Now, methylmercury intake also affects the brain and could result in a decrease of IQ. But his decrease of IQ that he saw was only 1/100th of an IQ point. So the cost-benefit analysis is pretty clear that the benefits of eating fish far outweighs any sort of concerns you might have of mercury in that fish. So that's when we talk about fish itself and not the supplements. Okay, next slide. Another concern is fish oil production is depleting the oceans. This is our sustainability question. Okay, next slide. Well, we can tell you that generally fisheries that supply omega-3s are sustainably managed. And the Peruvian anchovy fishery, that's the one where we get most of the supply for supplements, that's monitored by a scientific body that mandates a quota of each fishing season based on the fish and the number of juveniles and all that, so that if it starts to get too low, they have to stop fishing. And in fact, they canceled 2 fishing seasons for these very reasons. So they are committed to the sustainability of the fish stock here there in Peru. The tuna and the salmon oil industries also, when they are working, the tuna and the salmon oils come from byproducts of the seafood industry. So I know that there's sometimes concerns about fish taken out of production for human consumption and being used for fish food to feed supplement fish. That's not really what's going on. What's happening is they're eating parts that humans would never eat. And so that's going in and that's feeding the fish that then are destined for supplements. And also the Arctic cod fishery is Marine Stewardship Council certified, MSC certified. So all of these different ways that we can communicate to consumers about sustainability and omega-3s. Okay, next slide. So just to continue on with how best to communicate to consumers, the good news is this isn't something that you have to work on your own. GOED has tools for you to help you do this. And as I mentioned, we have the Always Omega-3s website, which is alwaysomega3s.com. And this is a website that's in both English and Spanish. And a lot of our infographics and the videos are translated into other languages as well, so that you can help. And we encourage companies to take these pieces of information and use them and adapt them for your audiences. So our website is mobile friendly. So the picture that we have on the left side, that's a screenshot from our mobile website, and then these other desktop versions. So it's easy to navigate and to scroll through and to help consumers get the information that they need. Next slide. And like I said, a lot of the materials are available in different languages. And if there is something that has not been translated that you would like to have translated in your language, we would love to be able to work with you on doing that very thing. Because the more information that we can get out there in languages and in fashions that people can understand, the better it is for all of us. Next slide. We also have fatsoflife.com. This is our healthcare practitioner website. And this has all of the same information about omega-3s and heart health, brain health, eye health, and prenatal health, but it really breaks it down into the different studies so that healthcare practitioners and scientists can dive deeper into the research and have the studies right there at their fingertips. We have a few actually it's only 2 infographics right now that are available on the website, handouts that we use just for healthcare practitioner audiences, including this one that we did just last year on omega-3s and bleeding. Again, it's not a fact sheet that consumers would be interested in because nobody wants to introduce the idea of bleeding to a consumer, but comes up a lot in our healthcare practitioner audiences. So when we do events or when we have communications to healthcare practitioners, this is one of the pieces that they've asked for and that now we're able to provide. Next slide. And this is just another screenshot of what Fats of Life looks like as you dive deeper into the different health areas. So as you talk about omega-3s and brain development, visual development, and et cetera, then you can scroll in and you can actually get links to all of the studies in that area on PubMed. So what I like to think of Fats of Life is like the PubMed section on omega-3s specifically. It's all right there. Next slide. So that is really the content of my presentation. I just want to leave you with these main points, which are that ALA, EPA, and DHA are indeed all omega-3s, but we need more of the EPA and the DHA in our diets for many of the reasons, mostly because we're just not getting enough of that, and also because that is where the health benefits truly are. And EPA and DHA are associated with heart health, brain health, eye health, and prenatal maternal health specifically. Those are the areas with the strongest research behind them, and that's where we do most of our communicating to consumers and to healthcare practitioners. To boost your EPA and DHA levels in your blood, seafood meals are good, but seafood and supplements, and those fortified foods as well, is a much better strategy for getting your EPA and DHA levels higher, higher than they are today, and maybe even higher than that as more research is coming out. And as I mentioned with the consumer research, awareness of omega-3s are high, but intake is still lacking. So communicating effectively in a way that consumers can understand, whether you talk with them directly through social media or through other lines of communication, or if you do it through health influencers, that can help change behavior. And behavior is what's going to sell products. So all of that in the end should benefit your companies. And with that, I will turn it over to questions.
Thank you so much, Alana. Very, very nice to hear that and to get some overview of this whole topic, and a very good presentation. Thank you so much. Yeah, let's see if there are any questions. I will stop sharing now so I can revert back to the normal.
Okay. And I can get started while you're getting ready,
Okay.
Venka. Because Alana, I had a question that's actually from me. You mentioned in your the part about talking to consumers. You talked about media and the importance of getting in the media, but we didn't really talk about social media. So can you talk a little bit about the work we've done on the social media side to educate consumers that way?
Yeah, I mean, social media is that's really where consumers are. I mean, we want to be able to get big, news stories in major newspapers, but the average consumer is getting most of their news online now. And social media is a way for us to be able to control the message a lot better, control the content. So we've done a lot. We have our own alwaysomega3s.com, Facebook, Instagram, and Twitter pages where we post content. We even have ways to boost that content through, pretty inexpensive advertising that we're able to do to get it in front of not only our followers, but people who may want to follow us and to get more information beyond that. And we also, like we talked about, we work with social media influencers, those dietitians who have their own platforms and who are able to amplify our messages, our infographics, our videos through their channels. So again, people that might not already be followers of Always Omega-3s or of GOED, but who will at least get our information in front of them and hopefully will become our followers.
And I could just add an additional way that we have been playing around with social media, just for those of you in the audience. When there's a negative story or a negative study about omega-3s, we will sometimes do a rebuttal campaign to an audience who may have seen. There was a few months ago, there was something in the New York Times that was really negative and inaccurate. And, in addition to us writing a letter to the New York Times, the letter to the editor, we also did a campaign to people who might have seen that article. So to set the record straight, or to show them the other side of the story. So that's another way, if you're thinking about ways to increase your engagement with consumers, playing around with social media from a response, reactive in addition to proactive, is something else to think about.
Very good, very interesting. And I love your tools. I mean, I hope that the audience can really start using that. And I guess some of them already are. Are they all free for the ones? Yeah. Okay.
Yes,
so
they absolutely are. Yep.
Okay. Very good. No, and I'm glad to have this information. I'm sure a lot of the attendees are as well. We have like 3 minutes left now, and I see there's one question. Yeah. Do you have something about omega-3 and children autism?
And
Alana, go ahead.
No, so I saw this question 20 minutes ago, so I have an answer, and Alana may have an additional answer, because that's not an area that we really cover broadly, or believe there's a lot of science. So while I was behind the scenes, I was looking at a clinical study database that GOED is developing. So we are building a catalog of every single human study on omega-3s. So I went to the clinical study database just to see what we have on autism. And it's a very small body of evidence. If I look at interventional studies, there's 16 interventional studies, 11 of which are positive. And all I'm doing right now is looking at a list of studies. So I'm not looking at the details of the individual studies, but they seem very heterogeneous, so that they're not very concise in terms of the same population, the same exact outcome, the same measurement. So I think that the research is probably it's definitely early stage, but I think that it's trending toward positive, but at this point there's a lot more research that needs to be done. So Alana, you may have specific additional.
Yeah, I was going to say the same thing. I know in the dietitian world, there's a lot of questions about diet and autism in general. And, there's a lot of hope for omega-3s, but we're just not at that stage yet with the science.
Okay. And I see there's one more question actually in the chat. What does research say about higher level of omega-3s? If we eat seafood every day, do we still need to take an extra through capsules?
So my answer to that is, if you eat seafood every day, that's fantastic. Of course, we want to make sure that it's an omega-3, what we call like the right seafood or something like that. I think that there is no downside to taking more omega-3, or there's no upper limit, let's put like that, of omega-3s. So I think maybe your best bet could be to get your omega-3 levels tested. And if what you're doing in your diet already is sufficient, is getting you to that optimal level, then you might not need to make a change. But in the absence of having taken a test or something like that, I would still opt to take a supplement just for my own peace of mind. But that's just me. I don't know if Ellen, if you have a different answer.
No, I agree. I think we're at the stage where we're starting to learn a little bit to be confident saying more is better. And but Norwegians eat a lot more seafood than Americans. So
that's true.
So we are definitely not eating seafood every day. So you may be fine with eating seafood every day, but yeah, it depends how much, it depends on the kind, etc.
Okay. And there's two more questions. One is, do you have any tips on how to strategize the degree of complexity of information intended for different customer bases? Okay, how do we translate that? How to deal with the degree of complexity of information intended for different customer bases? I think that's the question.
I mean, I can try to address that if, especially as we're talking about how I was explaining how to talk to a consumer versus talking to a healthcare practitioner. I mean, ultimately, your message is the same. It's just how you arrive at that message and how you are able to convince the audience of what you're trying to say. So think about what it is that you're trying to say, and then start start less complex, and then, you know, gauge your audience, you know, to try to figure out what is it that they need to know, how much detail do they need to know, and revise from there. I mean, I think that's, I don't know if I'm quite answering the question, but I think, like I said, you know, with any healthcare practitioner, it's funny, sometimes when I would go to those conferences and talk with nurses, for example, I would start in way up here, and then I realized, gosh, they still don't even know how to read a supplement label. Like, we need to go way back and talk here. And so, and that was just a learning for me. But as you continue to have these conversations, I think it's important, and you learn and you adapt and you revise.
And I would add that we in the industry forget how little consumers really know. And, you know, Alana showed a slide that shows omega-3 awareness is high, but they know omega-3s generally. They can't really tell you why it's good. And they definitely, unless you're in Japan, don't know the words EPA and DHA. So we have members all the time telling us that we should really be educating consumers about EPA and DHA. And we keep saying they're just not there yet. So you really have to meet them where they are. And like Alana said, you really have to start a lot simpler than you may think you do.
Okay, good. And the last question so far is about the source of omega-3. Is it better with krill oil or fish oil in supplements?
The benefit is with EPA and DHA. So how you get them, I think, is a point of preference at that point.
Okay. Yeah. Good. Well, I think that was it with the questions. And we also had one question about your presentation, and you will get that as attendees. We will send that for you as a PDF, and it will also be available on the Blue Legacy webpage. Sorry. So I think we have to summarize now, I think it has been really good. Thank you so much. Even I'm sorry for these technical issues that we had. I hope we did not disturb for you as participants. But I hope you get it, and you will also, of course, get a complete presentation. So the last thing I would say, please also look into the Blue Legacy calendar, because we're having more webinars to come. And in June, we will actually do 3 webinars, which may be of relevance for some of you, on the topic of enzymes and enzyme technology as tools to explore the potential and value creation of marine raw material further. How could we build new products? How could we be more green in our processing? How can we use enzyme as a tool to do better products? So these webinars will be in Norwegian, but you will find those and be able to register in our calendar. And also, we are grateful if you as participants communicate to us directly back, to Alan, to Alana, or to us. If there's anything more you would like us to address, we are here for you. So please let us know if there are things we could support you on. I think that goes for both organizations. And thank you so much, Alana and Alan, for doing this together with us. We appreciate that a lot with your fantastic expertise. And I hope the ones participating will revert and join others' activities with GOED and Blue Legacy in the time to come. So thank you all, and have a good day. Thank you.
Thank you.